For the latest information regarding the COVID-19 pandemic in Cupertino, please visit cupertino.org/coronavirus.
Good afternoon. My name is Corina Herrera Loera. I'm a public information officer with the Emergency Operations Center here in Santa Clara County. Today we have two very special guests who are here to discuss the vaccines and also to discuss about learning about your rights and knowing your rights, especially as an employee here in Santa Clara County. But before we get to them, I'm gonna give an update as to COVID-19 and the vaccines, just a general update here in our county. So we'll go ahead and start. The first slide that you'll see is the slide regarding just the cases in our county. And I do want to highlight, as I do every other week, that we as Latinos are 25.8% of the Santa Clara County population, but make up 50.6% of the total COVID-19 cases. So as you see on the bottom of our screen, you will see this website where this information is updated on a daily basis. And as we get the numbers on a daily basis, we will update our dashboard. And the next slide, we're covering here the death rates in our county specifically. And so again, as I mentioned, the Latinos make 25.8% of the Santa Clara County population. However, they make up 28.5% of the deaths in our county. And in our next slide, you'll see that this was actually taken from a KQED article, which dived even deeper into some of these numbers and the data and really broke down the age. And so here, if you can see the 18 to 34 the Latino population within that age group, unfortunately, the percentage of COVID deaths, they made up 79%. And so these are numbers that we, in these forums, we haven't covered yet. However, when I got this information, I thought was very important to cover, because I think a lot of us believe that, COVID-19 affects our elderly the most. And although it does affect our elderly, these numbers show that our young Latinos are also being affected. And so you'll see the numbers break down from there. The 35 to 44, although they make 26% of the population, they make 74% of the deaths. And then the 45 to 64, although they only make 20% of the population, they make 47%. And if you can see the interesting change there in the percentages. But I do want to highlight the 18 to 34-year-olds that we've lost, the 79% of the COVID deaths, which is a high number. And so unfortunately, this slide you won't see in our COVID Santa Clara County dashboard, but the other ones you will see. So just wanted to make that clear. We can go to the next slide. And then this one, we're highlighting the vaccinated by race and ethnicity for the 16 and over. So this number, if you can see here, was pulled on April 11th. And so as of that day, 24% of our Hispanic Latino community had been vaccinated. I did look at the numbers right before we got onto this community forum today, and I'm happy to report that we are at 27% of our community. So those of you who have been making your appointments, and going these past couple of days, thank you. And, we're encouraging our communities to go and make their appointments. And so there you'll see the breakdown of the different ethnicities that have been vaccinated. And unfortunately, the Latino population, as you see here, are the lowest out of the entire county. Next slide. And so here, I just want to highlight some of the numbers. If you see, this is a map of our county, most of our county. And so if you see the highlighted part on the bottom, that's South County. And then up, you'll see the freeways, that will kind of show you the 280, the 101, and you'll see the east side and the darker numbers. So where the darker colors are, that means that's where the highest rates of COVID-19 are. And then the lighter, that means the less. So if you can see, towards North San Jose, I mean, you can see towards the west, the white, obviously, I mean, that tells you the difference, right, between the white and the dark navy blue there. The less, how they have less cases there compared to the east side or the South County. And so just really, continuing to highlight that, because that's still our reality here today in our county. We still have high numbers of COVID-19 cases. Even though, unfortunately, we've gotten issued or directed by the governor, we hear the June 19th date now. And so, therefore, it's very important for all of us to get vaccinated, for all of us to now to make that appointment and get that vaccine, because COVID-19 continues to be affecting our communities. If we can go to the next slide. And so with that, we just yesterday opened up as a county for all individuals ages 16 and over who live and work in or work either or in Santa Clara County are currently eligible to get the vaccine. And so you can go on scfreevax.org. You can call 211. We do want to let people know that we do have staff going to homes. I've gotten some messages from friends that they have people visiting them at home. We are doing our best to get our entire county vaccinated. And so, however, when somebody comes to your house, they do need to have a county ID. We've also gotten information that unfortunately some people are taking advantage and are going to homes and asking for social security numbers, asking for money to make appointments. Our staff will never ask for any of that information. They will not ask for your social security number. They will not ask for any money to make an appointment. Our staff are going out. They're helping our community who might not have access to the internet, who might not have a smartphone to make the appointments in person. Next slide. And so again, rinse and repeat. We're going to continue to message this out until we are out of this pandemic. Unfortunately, we're not out yet. So it's still important to stay outdoors, still important to stay masked, to maintain at least 6 feet distance from others, to avoid crowds, to get vaccinated when it's your turn, to get tested, especially if you are at the front line working or exposed to the public. And so scfreetest.org is where you make your appointment for the testing. And then the SCC Free Vax is where you make your appointment for the vaccine. And so just to finish up here, again, you can call 211. Some of us prefer texting, and so there's also an option to text. You can text COVID-19 to 211-211. And then we have another option. Weekly, we are holding a phone banking that will have staff from our office answering phones tomorrow, Thursday, April 15th, from 5 to 7 p.m. We will have staff answering phones in English and Spanish and various languages, Vietnamese, Chinese, Tagalog. And you can call 408-970-2999. That is the number to call tomorrow, Thursday, April 15th, between 5 and 7. These phone banks will be happening on a weekly basis. We typically are having them on Wednesday. This week we're having it on Thursday. But we will continue to get the message out. So those who don't have access to the internet, if you know somebody who doesn't have a smartphone and just needs to call somebody to help them make that appointment, that is also an option. And so we have many vaccines available this week. We are happy to report that. I know a couple of weeks ago that was not the case. And so we're happy to report that we have vaccines. If you haven't gotten your appointment, make sure to make your appointment if you're 16 and over. And we look forward to getting our community vaccinated and to hopefully be at a place where we're all safe and able to reopen as the governor has directed the state and has put down that date of June 15th. We're looking to doing that in a safe manner. And so with that, thank you so much. I am now going to introduce our guest speaker, one of our guest speakers. Her name is Ruth Silver-Tobe. And Ruth is the employment law supervising attorney at Step Forward Foundation and the Catherine and George Alexander Community Center, Law Center at Santa Clara University School of Law. She supervises the Santa Clara County Office of Labor Standards Enforcement and Legal Advice Line. Thank you so much, Ruth, for being here. I know you have a wonderful presentation and information to give us. So we'll go ahead and get that on the screen for you. Thank you so much.
Thank you. Yes, I supervise the legal advice line for Santa Clara County's Office of Labor Standards Enforcement. And I'm going to talk about that at the end, but I'm going to start and talk about a very exciting development, which is paid sick leave. So next slide, please. Effective March 29th, so just a little while ago, 2021, the state of California passed and the governor signed a paid sick leave bill. And what's exciting about that is it's retroactive to January 1st, 2021. So if you were off work for any of the reasons I'm going to talk about between January 1st, 2021 and, until continuing until this law expires, you can go back and you can get your 80 hours of pay. The one thing about this pay sick leave too, the 80 hours, is they cannot require you to use your paid sick leave or your vacation first. So you cannot be forced to take your vacation or paid sick leave. I do want to say that there is one exception, and that's that it only applies if there's 26 or more employees. So if you have 25 or fewer employees where you work, this law doesn't apply, and I'll give you some other possibilities in the next slides. And what this is for illness and exposure to COVID-19, vaccination. So if you're going to get a vaccination, and recovery, if you experience side effects. And that's not if you anticipate you will experience them. You actually have to be experiencing them. Family care. So if you're taking care of a family member who was exposed, who has COVID symptoms. And school closure or quarantine because COVID exposure occurred on the premises. Now, this is a little different than the paid sick leave that we had before January and that expired in December. This has to be that your child caught COVID or was exposed to COVID at the school on the premises and that now has to quarantine because of it. So this is a really important law, and it's really, I think, going to make a difference now. Now, next slide. In California, we all have 3 days paid sick leave per year minimum, and it doesn't matter how many employees there are. 1 hour for each 30 hours worked, or they can give it to you right at the beginning. It must be on your pay stub. There's penalties if it's not on there, penalties if you don't get it, penalties if you're retaliated against for asking for it. And I just want to say for the employers out there that the 3 days paid sick leave have to be on the pay stub, and there has to be a separate entry for the supplemental state leave that I spoke about. So also, if you work in the city of San Jose, and this is only if you work in the city of San Jose, you get 80 hours of COVID paid sick leave, and there are no exceptions at all. And that's if you're COVID positive, you've been exposed, you have symptoms and are seeking a diagnosis, you must stay home to care for a child because a school is closed and they have no other option. So you notice that last one is broader than the on the premises, that it was contracted or you were exposed on the premises. This is just that the school is closed and you have no other option. So next slide, I want to talk about a fairly new law too. It's called the OSHA Emergency Temporary Standard, and it's called exclusion pay, and it's a type of COVID pay. It's actually, it's an emergency temporary standard, but it has the force of law. And this is only if you contract COVID or are exposed at work. And the first question is, must an employer pay an employee while the employee must quarantine and has no symptoms? So in other words, you were exposed. Yes, the employer must pay you if you contracted it or if you were exposed. In this case, it's only exposed. If you were exposed at work, you have to quarantine and you have no symptoms. They can require you to exhaust your paid sick leave, the ones I talked about first, but let's say you're a fast food worker and you're exposed, and then you're exposed again and exposed again at work. The employer must pay you for each time. Now, the second question is, does an employer have to pay if the employee is unable to work because the employee has actual symptoms, is sick? No. If the employee has symptoms, then they should apply for workers' comp. If you apply for workers' comp and it's taking a long time because there is a dispute, you can apply for state disability. Both are from the Employment Development Department. So next slide. This emergency temporary standard that has the force of law also has a number of employer obligations. And one of them is that the employer must pay for PPE, including face masks, or reimburse the employee for the cost. And what about testing? An employer must offer testing or permit the employee to get a test during working hours. So there's also a new law that was signed, AB 685. That's on the next slide. If an employer receives a notice of potential exposure to COVID, the employer must notify employees who are on the premises at the same work site within 1 business day of the notice of a potential exposure. And also, the employer is required to tell employees about benefits and options. So all those sick pay all the sick pay I talked about, they have to inform them about that. They have to inform them about workers' comp, state disability. Also, the bill requires an employer to tell all employees on the disinfection and safety plan that the employer plans to implement per the CDC guidelines. And as I said, I'm on the advice line, and I've had many calls from people who say, I don't know if they're cleaning. It's just the regular cleaning crew, or they don't seem to be cleaning. Well, this bill requires the employer to notify all employees about the disinfection and safety plan. Next slide. So on the advice line, we're getting a lot of calls from employees who say, look, I had COVID. It's been a month. Either I didn't have symptoms at all but had to quarantine, or I did have symptoms and they've been gone now for 3 weeks or something like that. But my employer will not let me come back to work until I have a negative COVID test. And their doctors have told them that they may not get a negative COVID test for some time, but that doesn't mean they shouldn't be able to work. So there are certain steps you can take. They sort of escalate. And one of them is to provide the employer with the county's letter. And the county has a letter that it discourages employers from requiring a negative test for several reasons. And if you don't have that, call the advice line and I'll email you a link. The other thing is that we on the advice line can call the employer and ask the employer why they're not letting people back to work when they've been symptom free for a month or whatever it is, or 2 weeks, or even the requisite amount of time. And every time I've done that, the employer has taken the person back to work. Now, if the employer won't, you can file for unemployment because, you know, you're not working, you're not permitted to work. And finally, this is regarded as or record of disability. So it violates the Fair Employment and Housing Act and the Americans with Disabilities Act, because they're seeing you as disabled and you are not disabled. And so we can help you file a claim with the Department of Fair Employment and Housing or the Equal Employment Opportunity Commission. Next slide. So you have probably heard this before many times, but I do want to reiterate the fact that the county will provide transportation to and from a hotel, pay for a motel or hotel, provide 3 meals a day, laundry, if you can't quarantine at home. And also, if you can, they will shop for groceries and provide cleaning supplies. And there is an income threshold, but there's a referral hotline. It's available 7 days a week, 8 a.m. to 5 p.m. And that's the phone number, 408-808-7770. So I apologize if I'm repeating it and you've heard it before, but I think it's a really valuable resource and we're all grateful that the county is providing it. So next slide. So I do want to talk about the legal advice line. I am on the English line and I supervise this advice line. It's offered by the Office of Labor Standards Enforcement. And there are lawyers who speak Spanish, Vietnamese, Tagalog, and Visayan as well. She speaks both Mandarin, and then we have the same person who is fluent in Hindi and Punjabi. So we're happy to talk to you about any workplace issues. And I do want to point out that it's for employers and employees. But also, we've been tasked with filing public health complaints. So if you see at your workplace, it doesn't even have to be at your workplace. You could go to a restaurant. You could be at an event and you see people without masks, you don't see social distancing, we can file these complaints for you and they can be anonymous. I'd say in all of the ones I've done, almost all of them have been anonymous. Or you can file them privately. And I've had a number of those where only the county knows your identity, and then the county can let you know if it's been resolved. And I also supervise a workers' rights clinic at the Catherine and George Alexander Community Law Center. The phone number is 408-288-7030, so you can call that as well. Thank you.
Thank you so much, Ruth. And I just want to remind our audience what an honor it is to have an attorney here. And I will be introducing a doctor soon, but she gave very detailed information. Thank you so much. And I know that people have questions out there. So as you're forming your questions, we will have an opportunity for questions and answers. Please remember that, we're focusing on what Ruth just presented on, and then also on the vaccines. And we'll get that presentation up next, but really want to take advantage of this time with our doctor and attorney here today. So thank you so much, Ruth. And without further ado, I'm going to introduce our doctor here today, who's been with us, and we're lucky to have him again, Dr. Gerardo Solorio Cortez. And Dr. Cortez attended medical school at George Washington School of Medicine. He completed his residency in internal medicine, Santa Clara Valley Medical Center, and is currently the primary care physician at the Valley Health Center in Gilroy, and also the physician at the Gilroy High School vaccination site. His professional interests are decreasing barriers to access to healthcare, including vaccination rates in underserved communities. Welcome, Dr. Gerardo Solorio Cortez, and I'll let you take it on from here.
Thank you again for that warm introduction, Karina. Again, always happy to be here. Good afternoon to everyone. Thank you all for being here today. And I think that the number one announcement that I think would be very appropriate to talk about today is the news that came out yesterday, both from the state and federal governments, the CDC, the FDA, and the California Department of Public Health, pretty much saying to pause the administration of the Johnson & Johnson vaccine. And the reason being is, as I mentioned in previous talks, when the vaccinations were rolled out, there's a system in place, both from the clinic sites and also internet-based, where adverse events are reported to these state and federal entities. And what they saw and the issues were blood clots. And the question is, where were these blood clots? They actually found these blood clots more common in the brain. And the people that were affected were, if you look at the actual results, it was women who were aged between the ages of 18 and 48. These events happened between day number 6 and day number 13 after they were given the Johnson & Johnson vaccine. A little bit of background. So blood clots is basically blood that clots in the system, in either the venous system or the arterial system. We have both veins and arteries in our bodies. In this particular case, we're talking about the vein system in the brain where the clots formed. And in addition, what was particularly different in these situations is that platelets, which is the parts of the blood that helps clot blood, when you get cut, for example, they were also diminished or low. So the combination of low platelets and clots made it something that the federal government, the state governments wanted to keep an eye on. So from that standpoint, it was to put a pause for the moment. It allows the state, federal governments to review the data and see how much of this is related to the vaccine, or is it a coincidence? Because in fact, when we talk about these blood clots, and the actual medical term is cerebral venous sinus thrombosis. It's a rare disease occurrence in the general population. There are about 4 cases in a million people if you were to look at all comers. In this particular case, we're saying, or in particular these cases, we're talking about 6 cases, and we've given about 8-9 million COVID Johnson & Johnson vaccines. So I think for us, or for me, I would see more of the system, state government working. Again, we want these vaccines to be efficient or effective and safe. And this is a way that the government lets us know that we're going to keep an eye on things just for safety. So as soon as they reconvene, the scientists, the FDA, CDC, and I believe they were reconvening. They're going to reconvene today, this afternoon. We'll know more of when we could restart giving back the Johnson & Johnson vaccine. Now, an important question is going to be, I've gotten the Johnson & Johnson vaccine. What should I do? Should I worry? I'm sure the words that I'm using right now is going to alarm people, in terms of the clots in the brain. It's very reasonable to think that you're worried. So the studies, or what this information tells us, again, as I mentioned previously, is these events happen from day number 6 to day number 14. So within 3 weeks would be like the period where you would be more cognizant of what's going on in your body. So the symptoms of a blood clot in the brain would be like headache. So if you're experiencing headache, that should signify, or tell you to, seek medical attention, either your primary care doctor, or if severe, I would urge you to go to the ER. Other sites where clots could happen include the legs. So if any leg swelling, leg pain that's severe, that's new, and you recently got the COVID vaccine, the Johnson & Johnson vaccine, then I would consider blood clot. If you get chest pain, blood clots could also go to the lung and cause shortness of breath and chest pain. So if that happens, also seek attention. And lastly, more rare to have blood clots in your tummy, abdomen. So any new severe abdominal pain, if it were to happen, I would also recommend for you to seek medical attention. And again, the dates is usually, I would say 3 to 4 weeks. It's very rare to have these symptoms 1 month after the Johnson & Johnson vaccine administration, but it's always important or be cognizant or err on the side of caution. If you're still 6 weeks out and there's a new headache, I would still just consider seeking, discussing with your healthcare provider. Other than that, I think that is the biggest news. We're also excited, just nationally, if you're seeing the latest numbers, about 200 million vaccines given. So super excited about that. We're also, as Karina has mentioned the data, super excited about the vaccination effort. So we would say, once you are up, you're due for your vaccine, please sign up and get vaccinated. And then lastly, I would say we're still administering the Moderna and Pfizer vaccine while we have this Johnson & Johnson pause. So let's get vaccinated. Thank you.
Thank you, Dr. Solorio Cortez. So now we're going to open it up to the questions and answers portion. I do see a couple of questions already up here. I'm going to start with Elena, who is asking to please provide the number of deaths from this vaccine up to today. Dr. Gerardo Solorio Cortez, my understanding is in Santa Clara County, there's 0 Johnson & Johnson deaths here in our county.
You're right. My understanding, the data is we just know it's national, and there were 6 cases. One was a death, and then another one is in the ICU, from my understanding.
Thank you. And then we have Margarita, who I think will join us in our Spanish one. So looking forward to seeing Margarita Fernandez en español a las 4. Let's see, we have Sherry, who mentions that there are no appointments available, and the other providers still do not know that 16 and over. So I'm assuming that she might be saying providers that are non-Santa Clara County, because we all know that Santa Clara County has a very clear directive to give anybody that's 16 and over a vaccine appointment. I'm also, I know that there are appointments as of yesterday. I supported a couple people to make appointments. So please go to scfreevax.com. This is through the Santa Clara County. And so I'm not sure what the other providers are doing or how that's going, but I could speak on behalf of the Santa Clara County. We currently have appointments available. So please go online or call 211 or get on our phone banking tomorrow between 5 and 7 to make an appointment. And if you already...
Can I chime in too, just as working on the vaccination sites, and I can speak for our sites. If, for example, if we have a person that's age 16 and that particular site has Moderna, that 16-year-old person cannot get the Moderna. So our sites coordinate an appointment to be made in whatever site is available for that Pfizer vaccine. So I guess maybe that answers the question, at least for, as you're saying, I don't know how other providers are doing it, but at least through the county sites, for example, Expo, Levi, and the Gilroy High School, they'll work together as a team and figure out which site has the right vaccine for the right individual.
Mm-hmm. Thank you for that clarification. And then we have Jacob Smith, who says, Silicon Valley Security did not want to give me this after, and then Ruth, this is for your portion. after I felt ill after receiving my second Moderna COVID shot. I was feeling bad side effects, and my HR person told me that I had to take a state sick pay first. I know there's no questions. Go ahead.
Yeah, I would advise that person to call the advice line, the 866-870-7725, and we should be able to help the person by giving them a link to this new supplemental sick pay to give to the employer. And if that doesn't work, we could call the employer. I did want to point out, too, that for this paid sick leave, the employer can take a tax write-off. So the employer isn't going to be losing anything if they provide this sick pay. But I have called security companies before, and eventually I get to their legal department, and it usually works out. So please call. I'm also happy to give my personal cell phone. I have no problem with that. It's 408-621-5678. So if you'd like to text me first, and then I will call you right away.
Now that's the kind of people we have here in Santa Clara County. Thank you, Ruth. Very few attorneys that would do that, right? On a live YouTube and Facebook forum here. Thank you so much. We're so blessed. Again, thank you, Dr. Solorio Cortez and Ruth for being here with us today. We have another question here. Jacob, I hope it works out. Make sure to call Ruth. Tracy is asking a question about the colleges and in-person graduation. So we'll save that for when we have somebody that can speak on that. Tracy, I'll make sure to note that, and hopefully our one of our next speakers can come and talk specifically to that. Mireya Rojas says, very nice doctor. So thank you.
Very much.
I'm sure somebody that's seen you in the community and
thank you.
Had experience with you. And then Betsy Lopez she's asking, so this causing stroke, so asking if, I'm assuming the Johnson & Johnson, if that's causing stroke potentially.
It's a very good question. The main symptoms of this diagnosis is usually headache, some nausea, vision disturbances, seizures at the extreme, and coma. Potentially, yeah, if there's bleeding as well, there could be deficits of a stroke, I would say. If you're thinking about the classic, the one-sided weakness, potentially it could happen, but the most, what my understanding is from this diagnosis is usually headache, vision changes, and even seizures.
Thank you.
That's a good question.
And then we have Carmen, who was able to schedule her appointment today. Thank you so much, Carmen. I'm glad you were able to get your appointment. We have Mireya Rojas, VMC Online Vax SCC Gov lines Monday through Friday open 7 a.m. and Saturday through Sunday online opens at 8 a.m. Appointments are on different sites and times, very easy to schedule. Thank you, Mireya.
Thank you, Ms. Rojas. That's awesome.
See, and then we have Carmen. Are these new laws applied for those who have undocumented workers working for them?
Absolutely. Every law in California applies to undocumented workers. The only thing that undocumented workers cannot do is apply for unemployment. Other than that, they get state disability, workers' comp, all of the paid sick leave, all of the discrimination laws, every law that exists. If an employer is employing you, they must obey the law, whether you're documented or undocumented. Thank you so much for that question. It's a really important question. Otherwise, an employer could hire someone who's undocumented and then break all the laws, and we don't want that in California.
Absolutely. Thank you. And then Carmen also asked if you could repeat your number, but we have it down here as 621-5678. Is that correct?
Yes.
Okay, perfect. Thank you. And then Kathleen mentions or asks, how close are they to approving the vaccine for 12-year-olds enough?
I'm listening. Dr. Fauci is always, at least for me, the go-to person and the compass of when things are going to move in terms of vaccines and such. I mean, I remember last year when he was mentioning it will be a year for us, and that sure enough it happened. And now they're saying, or he's saying, and the entities CDC and FDA is moving to open schools in this fall. So being optimistic and studies are being done right now. So I would say probably in the next weeks, maybe 2 months, studies will come out and say that they're effective, and the emergency approval process will be started. Maybe June, July. That's my best guess, and then get started then, and hopefully, like as people are saying, by fall, open up schools, or have just more normalcy by that time. And I think for that to happen, you need these vaccines. So for the kids as well.
Mm-hmm. Thank you. And so far, those are all the questions we've received. Again, remember, we have the honor of having an attorney here and a doctor from our county who are here to answer questions specifically to our Santa Clara County. So if you have any other questions before we end today's forum, otherwise, as we maybe get a few questions here and there, any last words? We'll start with our attorney, Ruth, and then we'll close up with our doctor.
Yes, I'm always happy to update on the new laws. Please feel free to call the advice line or me at 866-870-7725. And as I mentioned, it's English, Spanish, Tagalog, Mandarin, Vietnamese, Punjabi, and Hindi. And they're all attorneys on that line. It's completely free.
Thank you.
And employers can call, and employees.
Mm-hmm. Great. Thank you so much. Dr. Solorio Cortez.
I would just add the similar sayings we've been noting in these talks and through our system. Once you're up for your vaccine, get vaccinated. Continue wearing your masks. Social distance. Be outside as much as possible. And get tested frequently as well, especially if you have any symptoms. Things currently here are in the county. The data shows that our cases are dramatically, coming down. We're getting vaccinated, so things, are more positive. But you've probably seen the news too, and this is not just to. I'm not here to stat in the things, but Michigan's having a tough time right now. So I think just we need to not let our guard down. Continue doing the things that are going to get us out of this pandemic, and importantly, when it's your time to get vaccinated, get vaccinated.
Yes, absolutely. And I do want to mention, at least for me, it was my dad's birthday on Monday, and we were able to gather with him because we're both vaccinated. We've cleared the time. I was able to give him a hug, where last year I wasn't able to celebrate his birthday with him. So that's an example of the things we can do when we're vaccinated. And so looking forward, to getting those appointments filled up. There's appointments there waiting to get you vaccinated. And if you're already vaccinated, make sure you help somebody that might need your help in getting that appointment. They are available now. We have many. We were blessed to get many doses for this week specifically. So get your appointment. And I think those are all the questions for today. Again, thank you so much. I mean, again, I can't mention what honor it is to have an attorney and a doctor here with us today, getting the information, the truth out, right? Making sure that any myths that are out there that we're able to answer and we're able to clarify those. So thank you to both of you. Thank you, Ruth, for providing us with your contact information. I'm sure you'll be getting many calls. I do want to remind our audience that we have a Spanish forum coming up with the same information in Spanish at 4 o'clock today. So if you have any parents, any friends, any buddy that you think might be good, that this information might be good for them, make sure you let them know to connect with us in our Spanish Santa Clara County Public Health site. So you can connect there, or you can connect through YouTube. and send in your questions. So again, thank you so much. Have a great 2 weeks, and we'll see you all again here on our community forums, bi-weekly community forums in a couple of weeks. Take care.
Thank you.
Thank you.
Bye.
Thank you.
Thank you.
For the latest information regarding the COVID-19 pandemic in Cupertino, please visit cupertino.org/coronavirus.